interestingly, I want to start with a little historic background to the ketogenic diet. It was developed about over 100 years ago now in the US, based on an observation that when children were fasting and not eating food for a really, really long time, they would have less seizures. And of course, you can't have the children fasting all the time. So I don't remember the name of the neurologist who developed the ketogenic diet, but he developed that diet to mimic what happens in the body when you're fasting. And basically all the carbohydrates are cut out of that diet. And the diet is high in fats. About 80% of the calories come from fats. And then there is some protein and a little bit of carbs in it, but not very much. An interesting fact is that when you're not providing carbs in your food, then you don't provide that to your gut microbiota either. And the specific microbes in the gut, or some of them are more dependent on carbohydrates from the diet than others. And they really forage on that. They metabolize those carbs. And we've seen in studies then when you remove those carbs from the diet, that those microbes also decrease in abundance. But as of today, there are lots of different hypotheses about how the ketogenic diet leads to less seizures. And it may be a combination of different mechanisms. But it's also really difficult today to know which patients might benefit from the ketogenic diet. Because in children, it's about half of the patients with therapy-resistant epilepsy, as you mentioned, that experience less seizures during the ketogenic diet, and half don't. And we don't really know what the reason is for that at the moment. We have some hypotheses based on our latest article, where we had a small cohort of Swedish children with epilepsy that started the ketogenic diet, and we analyzed the gut microbiota and the serum inflammation profiles on those children, and using machine learning algorithms and omics integration analysis, we could find that those children that responded to the ketogenic diet, they had a different gut microbiota and a slightly different inflammation profile than those children that did not respond to the ketogenic diet. Specifically, we saw infant-type Bifidobacteria that were present in the responders, and that correlated with higher TNF-alpha in the serum in the responders, and that this association we did not see in the non-responders. And we believe that this may play a role in the response to the ketogenic diet, because those Bifidobacteria, they disappear during the treatment, and the TNF-alpha also decreases during the treatment. For that line of research, I think we need to move into some in vitro experiments. We are currently establishing protocols to grow those specific Bifidobacteria in the lab. And we're developing small gut on a chip models, where we can also introduce human cells and human plasma cells to see if those Bifidobacteria isolated from the responders before treatment, if they can actually induce TNF-alpha production in vitro as well. And then the next step would also be to use animal models to see if those Bifidobacteria have some kind of effect, or what kind of effect they have in those experiments.